When patients come to us, it's intentional. They're seeking care to either improve their oral health or maintain it. So why is it that some patients are so quick to adopt our treatment recommendations on the spot, and some patients it takes a little bit more convincing? Usually those patients who adopt it on the spot are those that trust us and trust our recommendations. What we call this is rapport. And in this video, we're going to give you 6 quick tips to build rapport with your patients. At the Dental MVP, we use science to teach people skills to you, the dental professionals. Do not forget to subscribe to our channel, The Dental MVP, and don't forget to hit the bell so you never miss out.
Tip number 1 is going to be to hone in on those basic conversation skills, making sure that when you greet someone that you have positive energy and are positive throughout the conversation, greeting them by their name and knowing their name, the pronunciation of their name. If you need to put the phonetic pronunciation into the chart, then make sure to do that. And then also making sure that you're actually listening. So when someone is speaking to you, being actively engaged in the conversation, so you're not only listening to what they're saying, but also trying to seek to understand. If you're ready to take your small talk to the next level, make sure to watch our video on small talk. The link is below.
Tip number 2, show mutual attentiveness. Now, when your patient is talking, we really want to be interested in what they have to say. Don't fake it. Actually give them your full attention and get interested. Act as if there's something that you can learn from the person in front of you. What do they know that you don't know? What's exciting to them? Get excited with them. If they are telling you a story that really excites them, get excited with them, get passionate with them. A great thing to do is make some personal notes. Where did you guys leave off last time they were in the practice? Did they tell you that they were going to be going to a wedding this summer and they're super excited about that? Put that in the notes. Make sure to ask them about this wedding. If you can pick up where you left off, it really creates that strong connection and builds that rapport quickly.
Tip number 3 is to mirror and match. In this tip, we're talking about tonality and body language. When you're able to mirror and match tonality and body language, you're acknowledging to your patient that you understand what their emotions are, how they feel, if they're excited about something, or it's also a way of ensuring that you're not portraying any type of authority, that you guys are both equals. In tonality, if you have a patient that is really frustrated with something, it's okay to say, hey, I hear you, I'm frustrated too. And then you can start to guide the conversation a little bit more downward to a comfortable tone volume. But it's okay to kind of match where they're at and bring them to a good place. If you're having a conversation about treatment, if they are sitting in the chair, it's important to then sit in your operator stool, but also make sure that you're sitting and talking to them. If you stand while they're sitting, it gives this portrayed or authority figure, like you're telling them what it is that they have to do, which takes away that perception that it's a we-us conversation and that we're a team in what we're deciding with your healthcare needs.
That brings us into the next tip. Tip number 4, use terms like we and us. Like Chastity says, when you use these terms, it creates more of that team collaboration effect. You want your patient to feel like they're on the same team as you, that you are not this authority figure telling them what to do. You don't need to say, I recommend this. It can be, why don't we look at this together and come up with a recommendation? What do you think it is? Ask for their opinion. Have it be that collaborative effect so that your patient feels like you're a team working together. When you're really on the same page, that's when you're going to get that rapport building.
Tip number 5 is to find commonalities. It is absolutely no secret that we like people that are like us. And in turn, we are confident in recommendations of providers if we've decided that is someone that we like. So if you're able to create more of those Me Too moments, whether it's a hobby that you both have in common or an activity that you both like doing, those are great opportunities to be able to say, me too. This can be achieved through asking a lot of open-ended questions, just seeking to understand your patients. Definitely trying not to create any of those disassociation moments where you pause and go, oh, I don't really like doing that. You don't have to agree, but it's important that we try to find the Me Too moments to ensure that we find a lot of commonalities to allow our patients to like us and feel confident in us as providers.
The last quick tip is to be empathetic. And I know we talk about empathy all the time, but honestly, it is one of the most important things for us to do. In order to build that rapport, we need to be empathetic and understand our patients. and have that feeling of, we get it, we get you, we understand. We have a great video that dives much deeper into empathy and the 3 layers of empathy. The video is called How to Be Empathetic with Your Patients. Make sure to watch that to understand these 3 layers. Now, quickly, if we were to go through them, there's 3 different levels of empathy. You have the cognitive level, which is basically just understanding what the emotion is, right? So if somebody is talking, you can say, okay, they're angry. Pinpointed it, done, check. I know the emotion. Next is that emotional layer where you basically put yourself in their shoes. When's a time that you have felt angry before? You know what that feeling is and you have felt it before. That's making that more of that emotional connection with your patient when you can say, whew, I have felt that way too. And you can start to build off of that with them.
And you touched on an important part. So a lot of times what gets in our way as providers with really truly being able to recognize an emotion is instead of when someone tells us something happened, instead of us looking for a time where we had felt the same emotion, we look for a time where we've had a similar experience. And a lot of times that can really just prevent us from truly being able to say, oh, okay, I get how you're feeling in this moment, and I can actually understand the feeling myself because I've been in a situation where I felt similar. So there's definitely a different perception there when you're able to take it a step further than just recognizing the emotion, but truly knowing when you felt that yourself.
Exactly. So find a time where you too have felt this emotion. It doesn't need to be the same situation, but if you can connect with someone on feeling that same emotion, that already is going to build the rapport. Now, the most important step is that next level of empathy, that compassion empathy. And this is where you can take the emotions that you have felt together, the understanding of what that emotion is like, and you can do something with it. That is where you can help to create an outcome for your patient. Usually in our case, it's treatment that we're recommending, but we can help apply it to them in a way that is going to help them. So having that compassion empathy is one of the best ways that you can build off of this emotional state of mind that you've created with your patient and get them to go to the next level with you. As a team, we and us, like we've talked about.
So we have a challenge for you. See how quickly you can find 3 Me Too moments with your next patient. Make sure to document them in the chart so then you can continue to have that same level of rapport as you go throughout the appointments.
Did you like this video? Do not forget to like it and never forget to subscribe to the Dental MVP.